All right, today we're going to talk about wound care. Welcome and thank you for being here today. What I'd like to cover today in first aid measures and how we would take care of different types of wounds we may encounter at our facilities. We may have lacerations and we may have puncture wounds. We may also have abrasions. And then we're going to talk a little bit about identifying those. What are some signs and symptoms? What is the first aid for such cuts and follow-up care? When we talk about a cut, it's a separation of connective tissue elements. So we may see a cut on someone's finger or another area and it's just an opening. A laceration typically is a tear, it looks torn, it may have jagged wounds or it may not. A gash is more of a longer, deeper cut, and an avulsion is tissue that is not just separated but torn away from the body. And sometimes that avulsion can still be attached. When we talk about lacerations, puncture wounds, gashes, avulsions, we want to control bleeding. We want to make sure that we can control the bleeding to start with. So what we want to do is evaluate the cut and apply pressure. Once we know that we can control the bleeding and that we can go ahead and clean up the wound without a large amount of blood loss, then we can proceed to the cleaning. We want to establish when and how the injury occurred so we can get a little bit better idea of maybe how deep the cut may be, the gash may be, the puncture, etc. And once we do that, we want to go ahead and start irrigating that thoroughly. We can use soap and water or a wound cleanser and sterile water to really clean out that wound. Once we've irrigated and cleaned it really well, then we want to reevaluate. Are we going to be able to control bleeding? If we can control the bleeding, we want to get the bleeding under control again, and then we want to look at how we can close the wound. Is the wound going to be able to be closed simply with a butterfly? Will we need to use steri-strips? Or will this wound need to be sent out for evaluation for possible stitches or staples? If we look at the wound and we believe that we can use steri-strips or a butterfly type bandage, then what we'd like to do is go ahead and get out the supplies that we would use with some type of adhere type of solution that's going to help adhere the steri-strips and get out our steri-strips to try and do that. When we start to close the wound, what we would like to do, making sure that it's all clean and the bleeding is under control, we like to take the steri-strips and starting on the wound, place a steri-strip on either side and then pull that wound together. Once we've done that, then we want to anchor those sides down with some of the adherent that we may have. The laceration shouldn't be more than a ½ inch wide, and after cleaning thoroughly with soap and water and then possibly some type of wound cleanser, we apply those steri-strips, one on one side and the other on the other, and pull opposite to pull that wound close. Once we've done that and the bleeding's under control and the wound is nice and approximated and closed, then we can look at putting some antibiotic ointment over the top of the steri-strips, a very thin coat, and apply gauze dressing or bandaging and close that up. If we have an avulsion, we would treat as a laceration. We don't want to completely separate the tissue from the body. If we have an impalement, what we'd want to do is stabilize the object that's impaled in the body, never removing any impaled object from the eye or the body. So what we would like to do is if somebody had an impaled object, we want to stabilize that from moving and call 911 to get them transported. We have an example of hand laceration repair. It shows where we've got steri-strips and how we place those on either side of the hand wound and pull those together. Then once we have that laceration closed, you can see it here on the slide. It's nice and closed. That's where you would go ahead and take a small amount of antibiotic ointment and put that over top of those steri-strips. Then you can go ahead and proceed with your bandaging and get that closed up. What I always say is it's good to have bandages covering the actual wound, and as long as those outside bandages are the only ones that are getting dirty, when you take those off and the bandages that are inside remain clean, that's most important, because then you know your wound is staying clean and it's not getting affected by the elements. If you have somebody who has a puncture wound, then what you would like to do is proceed again, control bleeding. You'd like to go ahead and once you have the bleeding controlled and it looks like that you could clean it up and take care of it in-house, you'd like to take soap and water, or again wound cleanser and sterile water, clean out that wound very well. Then you'd want to go ahead and try to soak that in some Epsom salts for about 5 minutes. That will help draw out any other dirt as well. After you've soaked it, go ahead and clean it again with soap and water or wound cleanser and sterile water. Control the bleeding. Then what you can do is just take a little bit of antibiotic ointment on the puncture site. Go ahead and place that there, and then you can go ahead and cover with bandaging. The best thing for a puncture wound as such is to do that for 2 to 3 days, where you're using Epsom salts for 5 minutes, then cleaning the wound after soaking, and doing that 2 to 3 times a day for a few days. That's going to help facilitate healing and make sure that you don't get any infection. And as far as any other types of lacerations, puncture wounds, abrasions, avulsions, if you ever have a question, you can always consult with your occupational health nurse or your local physician or company physician. Thank you.